Hello, everyone. Today is Friday, April 23rd. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Friday is known as Get Tested for COVID Day. At the health department, we all try to wear our Get Tested t-shirts to try to raise awareness about the importance of getting testing for COVID. So I'm here today to give you a brief update on the impact of the COVID-19 pandemic on Mobile County and to discuss some current topics, answer a few questions, and then talk about our vaccine efforts over the next week or so. So worldwide, we are inching up on 145 million cases of COVID with over 3 million deaths. In Alabama, just over 1 million cases of COVID-19 with 10,840 deaths. And in Mobile County, we are reporting on 40,596 cases of COVID-19. I believe that's our first report of more than 40,000 cases for Mobile County. 27 were added yesterday. The number who have died with COVID is at 801. The cumulative number of people hospitalized with COVID is 4,886. That's an increase of 4 since yesterday. And then the number of people in the hospital with COVID is now up to 27. That's an increase of 2 since yesterday. And remember, we've been watching this really closely because it's been inching up just ever so slightly week after week since about 4 weeks ago when we got to just down, less than 15 people in the hospital. And now it's up. And this is a trend that we're seeing across the state. So, from the beginning of the COVID pandemic, CDC began counting cases of COVID by the date that they were reported. And we follow what the state health department does, and the state health department gets their guidance from the Centers for Disease Control. So we still are reporting cases as they are reported to us. So we've had lots of spikes this week, artificial spikes in COVID that are results of laboratories processing backlogs or urgent care centers entering backlogs of cases. And so our daily report continues to show the case count by report date, which is the way we have done it since March 19th, our first case in Mobile. So on our weekly report, we report the data by report date, but also by what we call case date or infectious date. This is either the date of specimen, I'm about to get this wrong, the date of symptom onset, the date of specimen collection, or the date of report, whichever is earliest. So that looking at it by a case date or infectious date helps smooth out the aberrations that are artificially created when you look at report date. So the state health department just Wednesday changed their dashboard over from using report date to using infectious or case date. And so we are working towards implementing that change with our daily report to show report and infectious date daily rather than just once a week. Give us some time. It's going to take some time to recode all of these, the reports that we have. So we're going to try to get that started the week of May 3rd. All right, let's see. There are just a couple of questions. I answered some questions earlier today about the reduction in people seeking vaccine. Across the U.S., across the state of Alabama, and in Mobile County, we are hearing from everyone who's providing vaccine that the demand for vaccine is much lower than it was early on. Perhaps this is sort of expected, where early on we didn't have much vaccine and we had only people who were at greatest risk for COVID complications and deaths eligible. And, we had large demand for vaccine. people getting really pretty testy when if you told them that they weren't eligible for vaccine yet. So we've worked through everyone who had made up their mind, yes, I want a vaccine. I'm going to go out of my way to get it, even if I have to drive downtown Mobile. So all of those folks are probably the ones that we have already vaccinated. And now we're sort of getting to where we need to get more young, healthy people to get vaccinated. So these are people who maybe, have the mindset of, I'm a young, healthy person. Why should I get vaccinated? But we need you to get vaccinated to protect yourself and your family and your community. And also that 16 to 50 age group also are the majority of our workforce, so it may be more difficult for them to get away. So we're just trying to work to reduce barriers to getting vaccine. So trying to address vaccine hesitancy, trying to get vaccine in the communities, out in the communities where people are, to make it more convenient for them to get it. Running late clinics, running clinics at schools, running clinics at churches, to try to reach that middle third of the population that maybe are not undecided or not sure if they want to get vaccinated, trying to compel them to do what it takes to get a safe, free, effective vaccine, because we need at least 70-80% of our population to be vaccinated. And right now, overall, we're sitting much, much less than that. I think overall it's around 30-40%. Nationwide, it's about half, so about 50% nationwide, but we're a little lower than that locally. And we have much higher vaccine coverage rates, of course, in the older age groups who have been eligible for vaccine the longest. So please, anyone who wants to get vaccinated these days can get a vaccine. We have 2 very safe and effective vaccines that are still out there, the Moderna and Pfizer. And if you are 16 and over, you should have no problem getting vaccinated. We hope to hear by the end of the day today about the short-term fate of the Janssen vaccine, the J&J vaccine. The Advisory Committee on Immunization Practices is meeting as we speak to review data, information, hear opinions, to think about whether to continue or lift the pause on administering the J&J vaccine. And if a pause is lifted, will it be for specific age groups or sex, that sort of thing. So stay tuned for that. When that pause was initiated, it meant that about 300 providers in Alabama were no longer able to provide vaccine. So we are really hoping that the data, that the ACIP carefully considers the data in front of it, and if the benefits of the vaccine outweigh the rare risks, then hopefully we can get back to using J&J and put those 300 providers back in business. Let's see. We have some friends, some viewers from Texas that lived in Texas when they first started watching our Facebook Lives, and they've since moved to Mobile. So they're asking, they're traveling back to Texas about twice a month and wondering how often should get tested. So honestly, you can get tested as often as you like, but it really depends on sort of what you're doing when you're moving to and fro. If you're, in your family, if you're just, interacting with maybe family members or friends and they've all been vaccinated, then you're keeping distance, when you get gas or when you eat out or, when you retail, then there may be no reason for you to get tested on a regular basis. But if you are, working, or if you're traveling to sporting events or other types of gatherings, then you may want to, get tested on a regular basis so that you can know if you have contracted COVID and maybe asymptomatic spreading COVID to others. So anyone who wants to get tested for COVID can do so by making an appointment at the Mobile County Health Department, 251-690-8889, or we now provide walk-in rapid testing for COVID on Wednesdays and Fridays at our downtown Keeler location at 251 North Bayou Street. Just walk in and let them know you want to get tested for COVID, and they'll direct you to completing the paperwork. I had someone from a church called earlier this week, last week, I can't remember. And they're planning, a small group of people are planning a mission trip this summer, and they wanted to see if they could get tested prior to traveling internationally, as many countries are requiring testing before entry, including the United States. But she said, we're just calling to see where we can get tested. I said, well, you can get tested here. And she said, how much? I said, it's free. And it just blew her mind, because they were looking at paying, $100 or $125 for testing, at other locations. And I said, no, we've been providing free testing since the summer. So come on, and we'll test you. All right, I just want to talk a little bit about sort of the things we know and the things we're still learning about COVID vaccine. Again, it's important that we continue to have these conversations. If on the Facebook today, or if you watch this later, if just 1 or 10 people change their minds about getting vaccine, then this time will be worth it. So I just want to read a couple things that key things that we know, and then just talk about where we're still learning. So we know it is a fact that COVID vaccines are safe and effective. We know that you may have some side effects, but these are normal. So the tender arm, maybe some body aches, you may have a slight fever. These are normal things that we expect following the COVID vaccine, and they should resolve in a day or two. All right. We know that it takes about 2 weeks after you're fully vaccinated for your body to build the protection against the virus that causes COVID-19. So after you get the last dose for Johnson & Johnson, it's just the 1 dose, but for the other 2, it's 2 doses. 14 days after that is when you are considered fully vaccinated. All right, what else do we know? We know that vaccines are more widely accessible now. This was not the case in December and January, but now we have plenty of vaccine in the freezers and in the coolers, and everyone 16 years and older is eligible for a vaccine. This is regardless of residency status, it's regardless of race, sexual orientation, it's regardless of whether you're an essential or non-essential worker. Anybody can get a vaccine, okay? 16 and over. So no reason not to get a vaccine, and it's totally free to you. All right, what else do we know? We know that people that are fully vaccinated can start to do some things that they had stopped doing because of the pandemic. So I'm fully vaccinated, and it's been more than 2 weeks since my last injection. So as a fully vaccinated person, I can go to my grandmother's house, who's also vaccinated, and take my mask off and be with her as long as I want to be, and hug her and talk to her and eat with her, things that I had not been able to do until I received my full vaccine series and then went that 14 days. So please just know that we have safe and effective vaccines. They're available for everyone. There's no reason right now not to take time out of your day to go and get a vaccine. So here are a couple of things that we're still learning. So just want to, make sure that you know that we're still learning about how well vaccine protects you from spreading the virus to others, even if you don't have symptoms. So we know that the vaccine is going to keep you safe from disease, but we're still learning to see to what extent the vaccine keeps you from spreading the virus if you have asymptomatic infection. We're also still learning about how long the vaccines will protect people. Right now, we're saying a good 6 months at least. You've probably heard the leadership for Pfizer and Johnson & Johnson have said that it is likely that a booster dose may be needed within 12 months of your initial series. So we are still learning how long you will be protected from a vaccine. We're also still learning about how many people have to be vaccinated before we hit that herd immunity or population immunity phase. Most people are saying 70 to 80%. That is the target that we're using right now, but we're still learning if it's more than 80%, if it can be slightly less. So that part of it, that is also something that we're still learning about. And we're still learning about how well the vaccine can protect against variants. So as you know, we have lots of variants. Most of them we have very little data on. The ones that are still pretty rare, we still are evaluating whether or not the vaccines and the treatments and the testing methods, honestly, will work against those. The most common one, the UK variant B.1.1.7, I was looking at some data earlier today that variant now makes up almost 50% of the COVID that's going around, that's being transmitted in the U.S. So we are still learning more about how well the vaccine will protect against the variant. We think it's pretty good against the UK variant, and still learning more about the other variants. All right, any other questions?
One question. What if your grandmother had been hanging out with non-vaccinated people before you went?
So the question comes that my grandmother scenario. So what if my grandmother had been hanging out with people who weren't vaccinated before I came around? So first of all, she won't do that because she's staying at home because she takes my advice. But in that situation, it's a little tough. So you do need to know who your people are, who you're, you need to be aware of your social network. I mean, this is no different than having a gathering at your house and having people come over that you either don't know if they're vaccinated, you don't know where they've traveled. Like all these things, you're inside, you're not wearing your mask. All these things raise the risk of COVID transmission. So I would have a conversation with my grandmother to say, hey, has anybody else been here? Have other people been visiting you? And to really try to learn what I'm walking into before I get there. So yes, please, use your noggin, and think about what you're walking into and the conditions that raise the risk of transmission, even if you're fully vaccinated, because we do know that there will be a small number of people who still can catch COVID and have caught COVID, even though they've been fully vaccinated. So just carefully weigh your risks and make good decisions. We've been talking about these things a long time, so I know you know what to do. All right, let's talk about the MCHD vaccine clinics that are coming up. Always exciting, always really exciting when we announce new first dose vaccine events. And again, these will be listed on our website at mchdcares.com. If you don't have a computer, then you're probably not seeing this Facebook Live presentation today. But tell your friends and your church members and your family members who aren't computer savvy that they can always call 251-410-MCHD to hear a recording of the current clinics. It's really important to check those sites because the times may not be exactly the same time that you got your first dose, for instance. So if your first dose was at a clinic that was 9 to 2, check the time of the second dose clinics because we've learned a lot of lessons and we've gotten really good at giving a lot of vaccine very fast, so we don't always need to be open as long as we were in the beginning. So anyway, first dose vaccines, these are the ones that we have planned today at Mattie T. Blunt High School on 5450 Lott Road in 8 Mile. We will be open to the public, first dose Pfizer vaccine from 4 to 6 p.m. Remember, first come, first serve, no appointments. 4 to 6 p.m. tonight at the Mattie T. Blunt High School in 8 Mile. Our staff will be there a little earlier than that, offering vaccine to students and staff there, but the public is welcome to come between 4 and 6. All right, on the 26th, is that Monday? I think that's Monday. The 26th of April, which is Monday, we have a first dose Moderna vaccine event at Little Rock AME Zion Church on 10,010 Fernland Road in Grand Bay. April 26th, 9 a.m. to 1 p.m. First dose Moderna, Little Rock AME Zion Church in Grand Bay. Again, first come, first serve, no appointments. And then on April 27th, so this is next Tuesday, there will be a first dose Pfizer vaccine event at First Baptist Church of Mobile at 806 Government Street. That's in Mobile. So again, First Baptist Church of Mobile, 806 Government Street. A note here, please enter via the South Jefferson Street entrance. Again, first come, first serve, no appointments, April 27th, 9 a.m. to 12. All right, those are the 3 first dose clinics that we have available that have been finalized right now. Let me give you information on a couple of second dose clinics. So we have, I think these are both, no. So next week we have a second dose Moderna and a second dose Pfizer vaccine event. And if you were not able to get your second dose at your kind of assigned date, if it's been a week later or a month later or 2 months later, then you can come and make up your second dose here. But remember, you have to bring your vaccination card, okay? All right, second dose vaccine clinic, Moderna booster dose for anybody receiving their first dose on or before March 29th. So this is, again, Monday at 8 a.m. to 12 p.m. at the cruise terminal. 8 a.m. to 12 p.m. at the cruise terminal, Monday, second dose Moderna for anyone who received their Moderna first dose on March 29th or earlier. All right, then on Tuesday, the 27th, we'll be back at the cruise terminal with a second dose Pfizer vaccine event. So second dose Pfizer for people who received their first dose of Pfizer on April 5th or earlier. Again, this is April 27th, noon to 4 p.m. Okay, noon to 4 p.m. Please don't start lining up at 8 o'clock. Noon to 4 p.m., second dose Pfizer, cruise terminal, April 27th. That's the one where you have to, where we with Pfizer you can vaccinate 16 and over. So don't forget, bring your vaccination card. All right. Switch subjects to rabies vaccination. Also very important, we have a rabies vaccine event tomorrow from 10 a.m. to noon p.m. at the City of Pritchard Animal Shelter on Rebel Road. Again, these are drive-through events for your pets. Put as many pets in your car as you safely can. Adhere to distancing and mask wearing as you're driving through. The rabies vaccine is an annual vaccine. It's $12 and it's payable in cash. So tomorrow, 10 to noon, City of Pritchard Animal Shelter, rabies vaccinations for dogs, cats, and ferrets. So that's it for today. I hope you guys have a great holiday. I know some of state government is closed on Monday, but the Mobile County Health Department will be open for business, and we'll talk to you again Monday at 2:30. Have a great weekend, everyone.